Welcome to our channel. Today, we'll be talking about an important topic: the differences and similarities between type 1 and type 2 diabetes. By the end of this video, you'll have a clear understanding of both conditions. So, let's dive in. Introduction to diabetes. First, let's start with the basics. Diabetes is a chronic condition that affects how the body processes blood sugar, or glucose. Glucose is essential because it provides energy to our cells. However, people with diabetes struggle to regulate their blood sugar levels properly due to problems with insulin. Insulin is a hormone produced by the pancreas that helps glucose enter cells, where it can be used for energy. But in diabetes, either the body doesn't make enough insulin or the cells don't respond to it properly, leading to high levels of sugar in the blood. Understanding type 1 diabetes. Let's start by looking at type 1 diabetes. This is an autoimmune condition where the body's own immune system attacks the insulin-producing cells in the pancreas. As a result, the pancreas produces little to no insulin. Without insulin, glucose can't enter the cells, so it builds up in the bloodstream. People with type 1 diabetes must take insulin injections regularly to control their blood sugar. Type 1 diabetes typically develops in children and young adults, though it can occur at any age. It usually comes on suddenly, with symptoms appearing over just a few weeks. Type 1 diabetes symptoms. So, what are the symptoms of type 1 diabetes? Here are the most common signs to look out for. Frequent urination. This happens because the body is trying to get rid of excess sugar through the urine. Increased thirst. As you lose more fluids, you'll feel extremely thirsty. Extreme hunger. Even though you're eating more, your cells aren't getting the energy they need. Unintended weight loss. Your body breaks down fat and muscle for energy, leading to weight loss. Fatigue. Without glucose, your cells can't function properly, making you feel tired all the time. Blurred vision. High blood sugar can affect your eyes, causing blurry vision. These symptoms tend to develop quickly in people with type 1 diabetes. Understanding type 2 diabetes. Now, let's talk about type 2 diabetes. Unlike type 1, type 2 diabetes isn't caused by an autoimmune response. Instead, it's related to the body's insulin resistance. This means that the body's cells don't respond to insulin properly. Over time, the pancreas may still produce insulin, but it's not enough to keep blood sugar levels normal. This leads to high levels of glucose in the blood, just like in type 1 diabetes. Type 2 diabetes typically develops in adults, but due to lifestyle changes, we are seeing it more frequently in younger people, including children. Type 2 diabetes symptoms. Type 2 diabetes tends to develop more gradually than type 1. Here are the key symptoms to watch for. Frequent urination. Like in type 1, your body tries to flush out the excess sugar. Increased thirst. As a result of dehydration, you'll feel the need to drink more. Fatigue. When your cells don't get the energy they need, it can leave you feeling constantly tired. Blurred vision. High blood sugar affects fluid levels in your eyes, leading to blurry vision. Slow healing. Cuts and bruises take longer to heal due to impaired blood circulation. Frequent infections. People with type 2 diabetes are more prone to infections, especially skin and urinary tract infections. Tingling or numbness. High blood sugar can damage nerves over time, causing numbness or tingling, especially in the hands and feet. The key differences between type 1 and type 2 diabetes. Now that we've covered the basics of both conditions, let's highlight the key differences between type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune disease where the body destroys insulin-producing cells, while type 2 diabetes involves insulin resistance, where the body doesn't use insulin properly. Type 1 usually develops in children and young adults, while type 2 is more common in adults, although it's increasingly being seen in younger populations. Type 1 diabetes comes on suddenly and requires insulin therapy for life. Type 2 diabetes, on the other hand, often develops slowly and can sometimes be managed through lifestyle changes like diet and exercise, along with medication. The similarities between type 1 and type 2. diabetes. Despite their differences, type 1 and type 2 diabetes do share some important similarities. Both types lead to high blood sugar levels, which can cause serious complications over time, such as heart disease, nerve damage, and kidney problems. Both types require regular monitoring of blood sugar levels to manage the condition. While type 1 diabetes is not preventable, type 2 diabetes can often be prevented or delayed through healthy lifestyle choices, such as eating well, exercising, and maintaining a healthy weight. Treatment and management. In terms of treatment, type 1 diabetes always requires insulin therapy. This is because the body doesn't produce insulin anymore. For type 2 diabetes, the treatment can vary. Many people can manage type 2 with lifestyle changes, such as eating a balanced diet, getting regular exercise, and maintaining a healthy weight. Some may also need oral medications or insulin therapy if their condition progresses. Conclusion and final thoughts. In conclusion, while type 1 and type 2 diabetes have important differences, they both require careful management to avoid complications. Early diagnosis and treatment are key to living a healthy life with diabetes. There are several alternative medicines and controversial topics surrounding diabetes, particularly in the treatment and management of the disease. These alternatives and controversies often provoke debate in both the medical community and among patients. Here are some of the most discussed topics. Alternative medicines and treatments. Cinnamon. The claim. Cinnamon is thought to help lower blood sugar by improving insulin sensitivity. The controversy. While some studies suggest that cinnamon may have a mild effect on lowering blood glucose levels, the evidence is mixed. It is often recommended as a supplement rather than a primary treatment. But some people may rely too heavily on it instead of prescribed medications. Apple cider vinegar. The claim. Apple cider vinegar is believed to help control blood sugar levels by slowing the digestion of carbohydrates. The controversy. Although small studies have shown positive effects, more large-scale research is needed. Apple cider vinegar can irritate the digestive tract and lead to other health problems if consumed in large amounts. Bitter melon. The claim. Bitter melon is used in traditional medicine as a treatment for diabetes, as it contains compounds that mimic insulin. The controversy. While some research indicates that bitter melon can lower blood sugar, its effectiveness and safety are still under investigation. Additionally, the potency of bitter melon can vary, making it hard to regulate dosage. Aloe vera. The claim. Aloe vera supplements are said to lower blood sugar levels. The controversy. There is limited clinical evidence to support its use for diabetes, and some studies have raised concerns about long-term safety. Aloe vera may interact with other medications, causing side effects. Berberine. The claim. Berberine, a compound found in certain plants, has been shown in some studies to help regulate glucose and improve insulin sensitivity. The controversy. While studies show promise, berberine can cause gastrointestinal side effects, and long-term effects are still unknown. It's also not approved by many health authorities as a mainstream treatment. Chromium supplements. The claim. Chromium is thought to help improve insulin sensitivity and glucose metabolism. The controversy. Although some studies suggest benefits for those with diabetes, the evidence is inconsistent, and excessive chromium supplementation can lead to toxicity or negative side effects. Magnesium supplements. The claim. Magnesium deficiency has been linked to insulin resistance, and supplements may help improve blood sugar levels. The controversy. While magnesium has a role in regulating glucose, its use as a diabetes treatment is debated. Too much magnesium can lead to digestive issues or even heart problems. More controversial topics in diabetes. Low-carb versus high-carb diets. The controversy. There's an ongoing debate about whether a low-carb or high-carb diet is better for people with diabetes. Some argue that low-carb diets help maintain better blood sugar control, while others promote a balanced high-carb, low-fat diet that focuses on whole grains. Different approaches may work for different individuals, but there is no universal consensus. Intermittent fasting. The controversy. Intermittent fasting has gained popularity for weight loss and managing blood sugar levels. Some research suggests it could help people with type 2 diabetes control their glucose levels. However, fasting can be risky for people with diabetes, especially if they are on insulin or other medications, because it may lead to dangerous blood sugar drops, hypoglycemia. The use of metformin in pre-diabetes. The controversy. Metformin, a common medication for type 2 diabetes, is sometimes prescribed for people with prediabetes to prevent progression to diabetes. However, there's debate over whether lifestyle changes alone should be prioritized over medication in prediabetes management. Insulin versus oral medications for type 2 diabetes. The controversy. In type 2 diabetes, some doctors recommend starting insulin early, while others prefer trying oral medications or lifestyle changes first. The timing of insulin therapy for type 2 diabetes remains a contentious topic, with some arguing it should only be used when other treatments fail, while others believe starting insulin sooner leads to better outcomes. Artificial sweeteners. The controversy. Artificial sweeteners like aspartame and sucralose are widely used by people with diabetes as sugar substitutes. Some studies suggest that these sweeteners may affect insulin sensitivity or contribute to weight gain and metabolic issues, though research is not conclusive. The long-term effects of artificial sweeteners are still debated. Stem cell therapy for type 1 diabetes. The controversy. Stem cell therapy is a promising but controversial area of research for type 1 diabetes. The goal is to regenerate insulin-producing cells in the pancreas. While experimental treatments have shown potential, they are not yet approved for widespread use, and there are concerns about safety, cost, and effectiveness. Bariatric surgery for type 2 diabetes. The controversy. Bariatric surgery is often used to treat obesity and has been shown to improve or even reverse type 2 diabetes in some patients. However, surgery carries risks, and there's debate over whether this is a viable long-term solution for diabetes management, especially in people who are not severely obese. The role of dairy in diabetes. The controversy. Some studies have suggested that dairy consumption, especially full-fat dairy, might lower the risk of developing type 2 diabetes. Others argue that high dairy intake, particularly in people with lactose intolerance, could lead to insulin resistance. The debate continues on whether dairy is beneficial or harmful for managing diabetes. Natural versus pharmaceutical approaches. The controversy. Many people with diabetes seek out natural remedies instead of relying on pharmaceutical medications, believing they are safer or more effective in the long term. However, doctors warn that untreated or poorly managed diabetes can lead to severe complications, and the efficacy of natural treatments is often unproven in clinical studies. Fat consumption and diabetes. The controversy. The role of dietary fat in diabetes management has been debated for years. Some studies suggest that a high-fat, low-carb diet, such as the ketogenic diet, can be beneficial for managing blood sugar, while others argue that high-fat diets increase the risk of cardiovascular disease, which is already a concern for people with diabetes. Our final thoughts today: while some alternative treatments and controversial approaches can offer benefits, it's important for people with diabetes to consult their healthcare provider before trying new therapies. Many of these options lack sufficient research or may pose risks if used inappropriately. Diabetes management is highly individualized, and what works for one person may not work for another. Thank you for watching. If you found this video helpful, make sure to like, subscribe, and hit the notification bell so you don't miss out on our next video. Stay healthy, and we'll see you next time.